Hi everybody, I'm Kristen Kelly and I am a registered nurse and Master's of Public Health and Epidemiology. Medela has asked me to provide a weekly update for all of you so that you can stay up to date on the latest news about the novel coronavirus as it relates to pregnancy or breastfeeding. Here's some updates to breastfeeding that we wanted you to be aware of. We wanted to take some time this week to remind you how breastfeeding and the provision of human milk remains important for your newborn. Now more than ever, newborns need as much protection as they can get during this current pandemic, and their own mother's milk provides that protection because it's very effective against infectious diseases. Mother's own milk strengthens the infant's immune system by directly transferring antibodies from the mother to her infant. Human milk is protective. As a reminder, the Center for Disease Control, UNICEF, the World Health Organization, and the Academy for Breastfeeding Medicine state that considering the benefits of breastfeeding and the insignificant role of breast milk in transmission of other respiratory viruses, mothers can continue to breastfeed even if they're COVID-19 positive, while applying all necessary precautions. Human milk and breastfeeding for families is important, as there have been many reports of formula shortages and price gouging of infant formula. So let's talk a little bit about home births. Interest in having a home birth has increased as families are concerned about entering hospitals during the COVID-19 situation. Not only are they fearful of contracting the virus, but they also want greater freedom in who can be present for their births. The American College of Obstetricians and Gynecologists believe that the safest place for you to give birth is either in a hospital-based birthing center, or an accredited freestanding birth center. Your hospital or birth center may be adjusting their policies. For example, there may be changes to the number of visitors allowed. Check with your hospital or your healthcare provider about your birth plan, and be sure to mention if you're planning to have a doula present during childbirth. Let's talk a minute about discharges and pumps. It's been reported that some hospitals are discharging mothers and their babies early. On day 1 for mothers with vaginal deliveries, and on day 2 for mothers that have had C-sections. So there isn't a lot of time to practice breastfeeding in the hospital and to get direct lactation support that may be needed. Now is the time to advocate for yourself and your newborn. Ask for assistance from the hospital and the lactation staff if you're having a hard time breastfeeding. And if you will be using a breast pump in the hospital, ask for a dedicated hospital-grade multi-user breast pump that you can keep in your hospital room, or plan on renting a hospital-grade pump and bring it to the hospital. Check out the rental options on Medela.com. You may also want to research available telehealth services in your local area before the arrival of your beautiful baby. Medela has been doing a great job of keeping up-to-date resources on their website, so check on the link above to access those resources. And above all, stay safe and healthy, and we'll see you all next week.